And shifting. Good evening, my name is Tamari Wilson, and today I'll be talking about meningitis. Meningitis is the inflammation of the protective membrane that covers the brain and the spinal cord. In those areas, as well, it causes a serious infection in the bloodstream. Most cases of meningitis in the United States are caused by a viral infection, but also bacterial, parasitic, fungal infections, and other causes. Some cases of meningitis improve without treatment in a few weeks. Others can be life-threatening and require emergency antibiotic treatment, typically caused by any sort of viral infection if treated. Some forms of meningitis can be prevented with certain vaccines. Meningitis can occur in newborns, the elderly, and commonly in individuals that have a weak immune system. Meningitis can be caused by any sort of viral infection, but it can also be caused by certain forms of bacteria as well. There are a few types of meningitis. These include bacterial meningitis, viral meningitis, chronic meningitis, fungal meningitis, and parasitic meningitis and other meningitises. There are four main bacteria that cause certain types of meningitis. There's Streptococcus pneumonia, there's Neisseria meningitidis, there's Haemophilus influenza, and Listeria monocytogenes. With the different types of meningitis, there is bacterial meningitis. This occurs when the bacteria enters a certain bloodstream and travels to the brain and the spinal cord. But this occurs when bacteria directly invades the meninges. This may cause serious ear infections, sinus infections. Viral meningitis is usually the mild but often clears up on its own, but it's also the most common. It's more like a cold type of the meningitises. It's very common in the late summer, early fall. This is pretty easy to take care of. Then there's chronic meningitis, which is a slow growing organism, which is the fungal meningitis. This is the fungus invades the membrane, causing chronic meningitis. Often it takes 2 weeks or more to form the symptoms. Then there's fungal meningitis. This is relatively uncommon in the United States. It mimics the same symptoms as bacterial meningitis. It's often contracted by breathing in fungal spores that are found in the soil, decaying wood, or bird droppings. Then there's parasitic meningitis. This is a pretty rare type. It usually can also be caused due to infections such as like tapeworms. That could be in the brain or cerebral malaria. Streptococcus. Streptococcus is a bacteria that is commonly found in the nose and throat. The bacteria can sometimes cause several severe illnesses in children, the elderly, and other weak immune system people. It's more commonly caused for pneumonia or ear infections. Vaccines help prevent these infections from spreading. In the bacterium, it's most caused by bacterial meningitis in infants and young children and adults. Then there's Haemophilus influenza, bacteria that is caused mainly in children. It's very common in kids. It's a type of bacteria that can cause many different kinds of infections. These infections can range from mild ear infections to serious blood system infections. Then there's the Neisseria meningitidis. This is the most common meningitis. It is commonly found in your upper respiratory, but it can cause meningococcitis or meningitis, meningococcal meningitis. When they enter the bloodstream, it's commonly contagious amongst children, amongst teenagers and adults, by spit, teardrops, coughing, sneezing, kissing. It can cause a local epidemic in college dormitories, boarding schools, or military bases. That's why a lot of kids have to get certain meningitis shots before they go to college, because it's a very common thing to get while in college. Then there's Listeria. Listeria is a bacteria that's typically found in unpasteurized cheese, hot dogs, and lunch meats. This is more commonly known as the pregnant woman meningitis. It affects pregnant women, newborns, and older adults, such as the elderly. Listeria can cause placental barriers and infections that last in late pregnancies and may be fatal to the baby. The bacteria is mainly found in moist environments such as soil, water, decaying vegetation, and animals, and can survive, even grow under refrigerators and in other food preservation measures. Symptoms of meningitis. The earlier stages of meningitis can be mimicked and feel as though the flu or some type of cold. The symptoms can become visible in a series of couple hours or even several days. Possible symptoms include sudden high fevers, stiffness of neck, severe headaches that seem different than normal, headaches with nausea or vomiting, confusion, or difficulty breathing or difficulty concentrating, seizures, sleepiness or difficulty with waking up, sensitivity to light, loss of appetite or thirst, and skin rashes that appear patchy. The prevention or treatment of these things is you could wash your hands thoroughly, practice good hygiene. If you're pregnant, please be careful with the particular foods that you eat and how they're handled. Make sure that they're cooked well. Cover your mouth. Make sure that you get the correct vaccines, whether that's the Hib vaccine for the Hib meningitis, the PCV13, the PPSV23, or the meningococcal conjunctive vaccine. Treatments depend on the level of severity of the disease. For example, if you have bacterial meningitis, you may need antibiotics or a combination of antibiotics, compared to the viral, where you would mainly need plenty of fluids, bed rest, and over-the-counter medications. The epidemiology of this is, in the United States, bacterial meningitis has an annual incidence of 1.3 cases per 100,000 of a population. Most 10 to 15% of people are infected with this disease and will sometimes as quickly as 24 hours, the symptoms will appear. A select few who do survive, about 1 in 5, may experience a variety of long-term disabilities, including hearing loss, brain damage, nervous system problems, kidney damage, loss of limbs, and skin scarring. How does meningitis relate to health? Since meningitis is a serious disease with varying types of relations to health, in a both positive and negative way. Positively, with this disease and the various strands and strains that we have, this allows scientists and doctors to understand what vaccines are needed to combat these strands, along with the different bacteria associated with it. It helps people learn about those things and learn what measures are needed to be taken to prevent the illness from spreading. Negatives would be, if untreated, the strain could mutate or become something worse, or it could spread to the point where it is not containable. And for people who have this, it could possibly cause them to die. Any interesting research being conducted? There are clinical research studies being done currently on meningitis. For instance, online I found on a website that clinical research studies have begun using volunteers to inject with vaccines or a vaccine to make and test for an even stronger combatant to meningitis and many of its common types. This can be used and helped. In conclusion, meningitis is a disease that's caused by bacteria and causes swelling in the brain and the spine, and can cause death if untreated or serious health issues. There are 4 types. Depending on the 4 types, will help you figure out how to treat it. This disease is related to health because it can affect the community in both a positive and negative manner. Lastly, there are plenty of clinical research studies being performed to help combat and defend against this disease. And these are my resources. And that is it. All right.